Good morning, this is Alice Lind from the Healthcare Authority, and with me I have...
Hi, this is Isabel Jones, also from the Healthcare Authority.
We are very excited to have our first webinar of a series on the integrated managed care in North Central region. Today's focus is going to be on the request for proposals. We're going to give you an overview of the request for proposals that we used in the Southwest region and make sure that you have an opportunity to give us feedback on that. There is a second webinar that is identical to this one that will be on Thursday morning at 7:30. If you have colleagues who would like to join at that time, go ahead and alert them about that. And this will also be recorded so that folks can listen to it later and have an opportunity to provide comments. So we'll just go ahead and get going with the webinar at this point. I want to let you know that if you have comments or questions about it, we'll hold those to the end and let folks raise their hand using the webinar functions, and we'll take those one by one. We did send out a link to the Southwest RFP and the comment tracker. Here is that reference again so you can recognize it, but it should have come to you in your email. We also want to alert you so that you're giving this the right attention, that we're asking for feedback at the end of this month. And again, at the end of this webinar, you'll have Jessica Diaz's email a second time so that you know how to give comments. So we'll launch right in. We wanted to first call your attention to the objectives that we set out for integrated managed care in the Southwest region, and this comes straight from the RFP. It's in section 2.2. The purpose of including these objectives was that we wanted to make sure that folks knew that we're not just moving money around and combining contracts. Our focus here is really to ensure that true clinical integration is the result of the integrated managed care contracts. So our objectives are to have, through this procurement and contracting activity, to provide the full continuum of comprehensive services, including primary care, pharmacy, mental health, and substance use disorder treatment through collaborative care coordination and the integration of services under a single entity. That's really the core objective, but you can see that we have several other objectives on this slide and that are outlined in the RFP that include making sure that as we go through the transition, we have seamless transitions for the clients, that we ensure continuity of care, and then also wanted to call your attention that we do truly want to partner with the accountable community of health in your region and the other entities that will be operating the mental health and SUD programs there, which Isabel will now talk about.
Next slide, please. So we wanted to give an overview of the two procurements that will occur in order to implement the transition to fully integrated managed care. The focus of the webinar today and the comment tracking tool that we're asking you to comment on by December the 30th is really on RFP number 1 right now, which is the procurement for the integrated managed care organizations. So that's the focus of today's webinar, and we will only sort of touch briefly on the fact that there will be another procurement that will come out shortly after the Mco procurement for another entity called the Behavioral Health Administrative Service Organization that will be the payer for crisis services and some other non-Medicaid services in the region. But today's focus is really on the integrated managed care RFP, which is sort of the larger RFP. So on this slide, you can see that we have two procurements that will go out. RFP number 1 is to select the fully integrated managed care plans that will operate in Grant, Chelan, and Douglas counties. Each plan that is selected and part of RFP number 1 is 2 contracts. So each plan that is selected has to sign 2 contracts with the healthcare authority. The first contract on the left-hand side is our Medicaid contract. And this is funded by a per member per month premium payment from the healthcare authority that covers all physical and behavioral health Medicaid state plan services for Medicaid enrollees. 90% of enrollees are eligible for and receive both medical and behavioral health services. That's what we call FIMC, or fully integrated managed care. There are some populations of individuals in our state who, for a variety of reasons, are not eligible for medical coverage via managed care, so they receive their medical coverage typically through our fee-for-service program, and they're not enrolled with a managed care plan for medical coverage. But those individuals are eligible for behavioral health benefits through the Medicaid program, and that's about 10% of enrollees. And so they are in a line of business that we call behavioral health services only, which is essentially a benefit package provided by the integrated managed care plans that only covers the behavioral health services. And so the managed care plans that are successful bidders as a result of RFP number 1, they sign 1 Medicaid contract which lays out the terms and conditions for both the fully integrated program and the behavioral health services only program, and again is funded by premium payment. They also will sign a second contract that we refer to as the behavioral health wraparound contract. This is funded by a portion of state-only dollars, and this contract supports some non-Medicaid costs for behavioral health services that support Medicaid clients. So what I'm referring to here would be things like room and board in a residential treatment setting, which cannot be paid for by Medicaid dollars, or non-Medicaid costs of operating a PACT team, things of that nature that are paid for today out of state funds. So the selected managed care plans will sign and are required to agree to both of these contracts. And both plans, they sign the exact same identical contracts. So we don't have separate contracts per plan. And then RFP number 2, which will be the second RFP to come out that we'll talk about in more depth at a later date, is the RFP for the Behavioral Health Administrative Service Organization, which administers crisis services for all residents in the region, and then some behavioral health services for people who are not on Medicaid. And there are some other functions that we anticipate this organization taking on, such as employing the ombuds for the region. And that contract is financed through a portion of the state funds in the region, and then also block grant funds. And so RFP number 1 states, as I mentioned previously, that the managed care plans must agree to both of the contracts, and it also just describes a required relationship between the selected managed care plans and the selected ASO. And I think we'll go to the next slide. So this slide is just a timeline that really starts now and takes us through January 1, 2018, which is when integrated coverage begins. The dates that we wanted to call your attention to on this timeline, the first big upcoming milestone that we're talking about today is the release of the Mco Procurement. We're targeting February 15th, 2017 to release the procurement. And we will leave the procurement open for approximately 60 days, so about 8 weeks. And that gives the plans enough time to respond to the procurement and to build a network of providers. And then it will take approximately 4 weeks for us to score and evaluate the responses to the procurement. So in total, after the procurement comes out, it will be about 3 months between the procurement being released and when the apparently successful bidder managed care plans are announced. So we anticipate, if we stay 100% on track, that we would be announcing the apparently successful bidders on or around May 15th. We have it on the timeline as June, just in case there's any, delay for a week or so in any of these timelines. But we are aiming to hit all of these dates, and we wanted to call out, sort of the importance of why we absolutely want to stay on track with these milestones. We've learned from our Southwest procurement that it's very important to select the plans as early as possible in the process, because there's a significant amount of work that happens after the managed care plans are selected to kind of transfer information from the community and the BHO to the selected plans, to do data sharing so that information about clients who are in active service can be shared, to do readiness review in a thorough manner, and to essentially make sure that everybody is ready and prepared for the go-live date. And so we want to be sure to kind of meet these early milestones so that we can leave a good 6 to 7 months of time after the plans are selected before go-live for the real work of the transition to happen between plans and providers and the healthcare authority and the BHO. So that's one of the reasons why we have a milestone of the procurement coming up shortly. And then with that, I think we will turn to the next slide. So we just wanted to go through a couple sort of procurement assumptions and housekeeping items before we get into going through each section of the procurement. So as in Southwest Washington, we expect that there will be no less than 2 managed care plans selected and no more than 3 for the North Central region. The procurement for the managed care plans is only open to managed care organizations that already have Apple Health contracts in Washington State. So it's not open to other managed care plans that are not already active in our state to apply for. As I mentioned previously, there'll be 2 procurements, the Mco Procurement and the ASO Procurement. We require, and we did in the Southwest RFP, sign contracts for network scoring with a section that addresses any gaps in the network. And then I think it's important to note, especially as you're reading through and commenting on the procurement questions, that this procurement is really focused on the addition of the behavioral health services that are new to the managed care plans and essentially integrating those services and the delivery of those services into their existing operations. It's not, as you'll see in the questions, strongly focused on asking questions about medical services that the plans are already under contract and providing and meeting contractual standards for. It's very much focused on how they will deliver these new behavioral health benefits that they haven't delivered before, and of course how they'll integrate those benefits with the medical benefits. But I think that's important to note as you're reading through the questions and commenting. As Alice mentioned at the outset, we are requesting comment on the RFP questions and recommendations for new questions by December 30th. So at the end of the webinar, we'll talk a little bit more about the comment tracking tool, but I think that was emailed out to you, and it's also available at the link that we provided. But we've created a tool that has all of the Southwest Washington RFP questions, which are the ones that we're able to publicly disclose that we're asking for comment on. We've created a tool for you to comment on those questions, for you to give us ideas of new questions that are not in the procurement currently, and to also tell us which of the questions are most important to you, which can help with our with how we set up our scoring. We want to be sure that folks on the phone understand that legally we can only release the Southwest Washington RFP because it's a public document. That RFP is the foundation and the basis for all of our future integration RFPs. So you can kind of think of these questions as this is the starting point. We are looking for you to comment on those questions and tell us how you think they should be changed or suggest new questions. But the Southwest RFP is what's public and what we can share and have you comment on. And that, again, will be the basis for how we develop the next RFPs. So when you see things like the word Southwest Washington in the questions, just know that we've, of course, already changed that, but that's what we are able to share. And then another similar tool, comment tool will be made available after we get through this process with the Mco RFP for the second RFP related to the ASO. Okay, I think we'll go to the next slide. Okay, so we just wanted to walk through kind of what we're going to be going in more detail on with you today, and this is all of the sections of the procurement. So the procurement kind of has two main sections that are scored. The first is the network submission, which is the contracts with providers, and that's in Southwest Washington, that was worth approximately 25% of the overall score. And then the second section of the RFP is called Exhibit C, and it's a list that's broken out by 8 different sections of about 47 questions. And the responses to Exhibit C, or the questions, are worth about 75% of the overall points. So the bidders have to respond to the 40-plus questions related to each section. The questions are scored. Each section and question are not scored equally. Higher weight is given to the questions that we deem to be more of a priority. And then separate from the questions, they submit the network of providers. The sections we're going to be going through in this webinar, each section, and kind of describing what the key questions are in that section and what the section covers and what the questions are that we want you to especially give us feedback on. But you can see in this list here we have, I believe it's 8 sections on MCO management, access to behavioral health services, questions related to the network, questions about community linkages with community organizations, quality assessment, IT systems and claims processing, utilization management and authorization of services, and then care coordination. So that's kind of how we've broken out the questions into these various topic areas. Next slide.
So just so you can follow along and note specific things that you might want to give us comments on, the distribution of questions and points in the Southwest version of the RFP can be found in the proposal specifications of the body of the RFP document. That's on page 26 of the original RFP. So you can, we're certainly open to your suggestions and comments about that weighting and distribution as well. We're going to start with the management section of Exhibit C. And so now, if you're following in the documents that are available out there on the early adopter website, the evaluation questions start with the management section. There's 8 questions there, and they, again, we know how management functions are operating currently for Apple Health Managed Care Plans. These questions were to get at how would those functions change and be adopted for first early adopter and now the North Central areas of the state. So we request that you look at a couple areas in particular. Questions 2 and 4 are specific to behavioral health administrative functions. And again, we know how these functions operate for medical services, but thinking about how you would expect the health plans to operate their utilization management functions, grievances and appeals, provider relations, quality management in a unique way for behavioral health services. We've asked questions about how those services will be operated and integrated into their current way of doing business. So those are a couple sections to look at. And then on question 6, we have a series of questions on how the toll-free customer services line would be adopted for behavioral health services. So again, take a look at those. Let us know if you have any feedback. The second section is called Behavioral Health Access. And these include 5 sections that ask bidders to demonstrate how they will ensure access to behavioral health services. The entire section we feel is critical for you to take a look at. First, there's a vignette of a client. We developed this vignette in consultation with stakeholders in Southwest. So take a look and make sure that it is a vignette that works for getting to the critical areas of access for North Central region. There are follow-up questions after the vignette that ask about how a case management file would be developed, how particular services would be available to a client such as the one described in the vignette. And then the questions 10 through 13 separately ask for access to unique services that when we went live in Southwest we knew would be brand new areas that the managed care plans who only currently manage medical services would not necessarily know off the top of their heads and would have to really dig in and get some on-the-ground knowledge about in order to answer. So again, any feedback on those would be quite welcome. The next section is the descriptive questions about the network. So this is on top of the actual submission of those providers who are contracted with the bidders at the time that the RFP is submitted. We ask questions of the bidders that really address additional material that we could not collect through the standard Excel spreadsheets, access databases, et cetera, that we collect our data on the actual provider contracts. First of all, I want to point out that we have a list that we developed for the Southwest RFP. It's on page 27 of the body of the RFP document, called Essential Behavioral Health Providers. And again, in consultation with our colleagues at DBHR in the DSHS administration and with local stakeholders in Southwest Washington, we came up with a short list of behavioral health providers that we felt were absolutely mandatory to have contracts with in order to go live in Southwest Washington. So take a look at that list of network providers for the behavioral health area. Let us know if we have missed any that are critical for North Central. If there are ways that we're describing these providers that seems inadequate and needs more descriptive information around it, totally open to that input from you. So other questions that are here are there other ways to collect data about the network that we should consider? And then we also, if you look at the question 16 in Exhibit C, we asked for strategies about how to transform the network in terms of co-location, rewarding high-performing providers, et cetera. As you may know, these are really critical to the Healthier Washington initiative, and so we anticipate that we, at this point, you know, a couple years have gone by since we issued this first RFP, and we may make this area even stronger in ties to the goals of Healthier Washington, to the 1115 waiver opportunities, et cetera. So any comments that you have about that would be welcome. The next section is the community linkages section. There's 2 questions here focused on the linkages between the managed care plans and the ASO that will be operating in the region, and between the managed care plans and the accountable community of health. And probably even more so than when we first went live in Southwest Washington, the role of the accountable community of health is even more important, just because you know, it's more mature across the state now than it was when we went live in Southwest. And so take a look at those questions. Any suggestions for how to strengthen the role of the ACH, or modify the questions to get to what's really going on, or what the expectations of the accountable community of health and other community groups and stakeholders should be in terms of operating the integrated managed care plans are certainly welcome. The next section is the quality assessment and performance improvement area. If you have ever looked at any of our Apple Health procurements in the past, you might think that this is a pretty short and sweet section. Again, it's because this is one area where every time we do a full-on procurement on the medical side, and every year when we do team monitor reviews of the managed care plans, we go very much in depth in this area. So we are quite comfortable with the way that they're operating the quality assessment and performance improvement areas for medical services. In these questions, we again want to get at how will those be modified for the behavioral health requirements. And so there's a couple references here to the performance improvement projects that are based on evidence-based treatment that's out of the Washington State Institute for Public Policy. There's also a focus on a children's behavioral health intervention. We are quite open to your comments on these areas and suggestions for performance improvement projects. The next section, F, is information systems and claims. There's 8 sections here. Again, we anticipate that the managed care plans will have to do some adaptation of their systems in terms of behavioral health. There's certainly new services that they were expected to have to address. Now, in the Southwest region, at the time we released this RFP, we were not sure how block grant dollars would be divided up, and so you'll notice in that RFP that there's references to the use of federal block grant funds. But if you remember, Isabel covered early in the presentation that federal block grant funds are only going to be allocated to the ASO contract, not to the MCO contract. So hold any of your suggestions and comments on block grants and the funds that are related to those until the next RFP comes out. If you, just feel so inspired that you feel you must make sure that we see a comment on block grant, then Jessica will certainly take it into account and move it into pile number 2 of the comments that we will go through and address for the second RFP. One more thing to kind of note here, a change that happened since we very first released this Southwest version of the RFP is that coordination of benefits is moving into the responsibility of managed care plans statewide. And so that's something that won't be so new as it was a couple years ago when we had expected coordination of benefits to be a brand new service for the health plans to be offering. The next section is utilization management and the authorization of services. Again, especially for providers that we anticipate you may have comments or thoughts about this section, you probably would want to overview the entire section. There's particular notes in here about the level of care guidelines for behavioral health authorization decisions. We asked questions about identifying clients who overutilize or underutilize behavioral health services. We're very concerned about making sure that folks get screened for behavioral health no matter where they show up, for example. So we have tucked in some of those issues here in the utilization management section. But again, this deals with all the kinds of new services managed care plans would not have had to previously authorize when they were only covering medical. So evaluation and treatment facility, et cetera. Thinking about the Mental Health Parity and Addiction Equity Act, those, we now are well past where we were when the Southwest RFP came out, and so we certainly expect the health plans to have thought about that and be able to respond to questions about that in a way that they couldn't have previously. And then the final section is care coordination. This section is in the Southwest version weighted very highly. We really feel like in terms of integrating behavioral health into the medical managed care contracts, that this is one of the functions that we expect managed care plans to deliver on in a very new and robust way. And so in the Southwest RFP, there were 11 questions related to care coordination that get to many of the different aspects that we're concerned about. So you'll notice here, and again, you know, this was not anticipating the 1115 waiver. It wasn't anticipating the availability of project toolkit funding that is going to be just soon on the horizon. So this, you know, we're very, very much open to your thoughts and ideas about how to strengthen this section of the care coordination, of all the questions in the care coordination section. First, you might take a look at the vignettes that are towards the end of the section, and again, these vignettes were developed in consultation with the folks down in Southwest Washington. You might take a look at them and say, you know, it wouldn't be a typical situation for us here in North Central, and suggest tweaks to the vignettes or replacing vignettes with clients that seem more typical in your experience. We anticipate, again, strengthening the connection to recommendations that are coming out of the BRE Collaborative on clinical integration. We anticipate building in a stronger link to the 1115 waiver and Healthier Washington in general. But if there are ways that you would suggest that we deal with those topics, we're very much open to your input on those too. So the next slide just gives you the logistical way of giving us feedback. There's a comment tracker out on our website. The comment tracker will go through some very detailed instructions about how to look at the RFP and the questions. It gives some open-ended areas so that if you have questions you would like to add, you're certainly welcome to do that. If you have suggestions for how to weight the sections or weight points within the sections, you can do that. If there's anything that we have completely left out that you think is critically important to the operation of an integrated managed care plan in North Central that you'd like to suggest, there's opportunities for you to use that comment tracker to do so as well. And we certainly are more than open to your suggestions for deleting questions altogether or tweaking the questions in a way that makes them more or less prescriptive than what you would care to see. So finally, we just are now open for questions. I think we've talked enough, and so we'll allow you to use that hand-raising function to alert us that you would like to ask a question, and as soon as we notice that you have your hand raised, we will unmute you.
And you may want to be 100% sure that you have entered your audio PIN, because we can unmute you, but I believe you have to put your audio PIN in to be able to speak. So please use the hand raise function, and then we'll go ahead and unmute folks to take questions. If you have a question, be sure to use the hand raise function. What tab is that under? Or
under there, they have a hand raise icon.
Okay.
It's just on their screen.
Oh, there's also a few typed questions, it sounds like. Why don't we start by reading those?
Okay, we have one from Andrea Toll. Are these slides available on your website?
No, not yet, but the webinar is being recorded and we will be posting it, and then we can email that link out to everyone who registered, so you'll have it available. We have no hand raises. Are we sure the hand raise function is working?
There we go.
Oh, we have one person who has a question.
Skip Rosenthal.
Okay, Skip, we're unmuting you.
It's not, scheduled to, can you hear me?
Yeah, we can hear you. Hi.
Okay. So Okanagan County isn't scheduled to join until 2020. I guess the question I have is, but we are going to be impacted by the contracts that are developed, through this process. I guess the question is how's that going to work, as far as developing the network and us having a role in evaluating some of the contracts, or the RFP and some of that?
So the same rules that applied in Southwest would have to apply in the RFP for any region, which is that we allow a process of one or two designated folks from a region to participate in the RFP development and evaluation who are not potentially contracted with the MCOs or the ASO. So no providers are allowed to participate in that evaluation. It could cause potential bias. But if there are folks identified in the region that in Okanagan, for example, when we move into Okanagan or future procurements, we'll talk about that as we get there. The current thinking about the 2020 regions is that because we are potentially looking at several regions coming up at the same time, there might be less opportunity for local folks to participate. And so that's one of the things that we have been long saying about regions volunteering to go live with a mid-adopter timeline, is that it really does give more opportunity for local input and involvement in the procurement. So, we kind of apologize about that up front, knowing that people are just really not going to be able to have as much opportunity to be at the table for evaluation as they would if they were in a mid-adopter region.
Okay. Well, they said we have people from Okanagan at the table too. I was just
yeah. Another just thought about how the procurements both in Southwest and in North Central will affect providers in other parts of the state is that we realize that every type of provider is not located in every region of the state. And so despite the fact that the MCOs are bidding to cover the clients in a particular region, they will have to have contracts or non-participating provider or arrangements with providers all over the state. And so we realize that it does have a potential impact on providers no matter where you're located. And that's why we wanted to make this stage of the procurement transparent to folks no matter where you are.
Right. I think a good example of that is we know that there's not an evaluation and treatment facility in Grant, Chelan, and Douglas counties, but I think Alice mentioned in the behavioral health access section, I believe it is the list of essential behavioral health providers, and evaluation and treatment is one of those essential provider types that would be a required provider type to be in the network. And so that's just an example of something that will have to be part of the network. It was outside of the 3 counties specifically. Do we have any other people with their hand raised? Okay, if other people have questions, please just go ahead and raise your hand.
I got one, John Chapman.
Okay, John Chapman from the Accountable Community of Health has a question. We're unmuting you. You should be unmuted now. Maybe make sure that you've entered your audio PIN and that you yourself are unmuted.
Sorry, on phone line.
Oh, if you have a question, John, you also could type the question, and we can just read it. Okay.
Okay, here's this question. How will the MCOs help in the investment of IT for BHO providers?
What I would say about that question is that if you feel like that is something that needs to be included in the RFP, this is your opportunity to suggest a question about that, or to put in a suggested requirement about it. So just please go ahead and send in that comment, and make it as very specific as possible so that the evaluators can help get to what your hope is.
Okay. Are there other questions? Okay. Okay. Well, if you have other questions after you dig in on the comment tracker, we would ask that you email them to Jessica Diaz. Her email is included in the slides and also included in the comment tracker, and she's the person who will be taking all the comments from the comment tracker. And so yeah, you can just email her any questions and we will answer them as best we can. As you know, we can't really speak to any of our intentions with this RFP. We have to kind of take your comments into consideration, but we can't necessarily disclose any changes that we're making for the North Central RFP. But feel free to ask questions and we will answer them as best I can. Oh, we have one person with
Laura Lee.
Oh, Laurel Lee, we're unmuting you.
Hello, can you hear me?
Hi.
Hi. Oh, my only question was, is the comment tracker something that folks can see all along, so you can see if somebody's already submitted a question? Like, is it an accessible document with a running question list?
No, it's a Word document, so we would ask people to just fill it out individually. It's not something, and then send their comments to us. So other people won't be able to see what people are commenting.
Oh, okay.
Yeah. Any other hand raises? Okay, so yeah, in terms of next steps, you have the comment tracker. The last thing I was just going to note is that in the slides we called out some of the questions that we especially want people to give feedback on, and then in the comment tracker you'll notice that those questions are actually highlighted in yellow. So we know that 47 questions may be a lot for everyone to read through and comment on by December 30th, and so if you want to kind of prioritize which questions you focus on, I would recommend that you look at the highlighted questions in the comment tracker. Those are the ones, again, that we really especially are hoping to get stakeholder feedback on. And if you need any sort of extension on your comments, let us know, but we are very much hoping to meet our procurement deadlines, and in order to do that, that's why we have the December 30th deadline. And then with that, I guess if there's no other hand raises or comments, then we'll go ahead and close up and thank everyone for participating. Okay, thank you so much. Bye.